the thread too steep, you can kink the catheter once it's threaded in the vein, and it won't flush or pull back blood or anything. So some pictures I took here in the ER the other day, just trying to give y'all some techniques of, when you first start, how to track the vein. So this is just showing, I took a blunt tip pen without anything on it and just put it on the skin wherever I wanted to mark it. Held it for 30 seconds. When you take it off, you got a good mark there. Then you can clean over top of it and everything and still use it. So once you locate a vein, you hold your probe there, you mark the skin right over top of the vein with your pen. You follow your vein up the arm on the screen, center it again, and then mark the next one. This will ensure if you have a vein going this way or this way, you'll know which way you need to track your ultrasound machine when you're threading the needle. Because all veins aren't straight, we know that. And that's a good technique for when you first start out, how to track the vein different directions. After a while, you kind of get used to it and you're able to do it without doing this, but this will help. So you see the little marks here, there's a mark there, and then you can put a mark there. And then once you clean it off and everything, you know right where to start and right where to finish. So that's a good way to track your vein in the arm. So prepping the site, prepare it with the same technique as inserting superficial IVs per protocol. Clean the skin, clean your ultrasound probe after you mark the site. Initially you can just put regular ultrasound jelly on the skin. You don't have to put any cover on, you're not sticking them. You're looking for the vein. Once you find it and you mark it, you clean everything off, clean the ultrasound probe, clean the patient's skin like you would start a regular IV. And then is where the other part comes in with the ultrasound probe itself. You can put regular ultrasound probe right onto regular ultrasound gel right onto the probe, cover it with a tegaderm, and then you put sterile jelly on top of your tegaderm. And that'll keep your site sterile and your probe sterile. I know ICU, you can probably use ultrasound covers for it instead of the tegaderm, but ER, we do so many of them, we just use the tegaderm.
I was like, what kind of technique is this?
You can just slap a normal tegaderm over it, that still keeps it clean and sterile too. So.
With the jelly inside of it and on top of it, on both
put your
sides
jelly
of it,
on
right?
top of the probe, put your cover on, and then your jelly on top of the ultrasound, on top of the tegaderm.
Why do you need 2 layers of gel?
Because if you don't put the gel between the cover, you won't get that'll block your signal.
Slide either. Okay.
Right, you won't get a clear image if you don't have gel underneath the cover.
It may be more cost effective to use the tegaderm than a probe.
It's a lot more cost effective, but depends on how many y'all do. We have on our machine itself, we have tegaderms, all the stuff to do that with, so we don't have to go run around and look for stuff. We keep the stock on the machine itself. But those ultrasound covers, they already come with gel already in it. So once you open it, the gel's already in there once they put it in. So that's kind of why
ours come with like a packet of jelly,
okay.
Yeah. You still have
So they still put it on.
Yeah. You
okay.
still have to put it on.
Good. Some of them are pre-jelly, just depends. But yeah, we use tegaderm. That keeps it clean, sterile. So jelly, cover, jelly again, or you can put. You don't have to put it on the probe itself. You can put it on the patient's skin and do it, just as long as it's on the outside too. And then if you place it on the skin, place the ultrasound jelly above the site where you want to stick. Put your probe on and then move down toward the site. That way you're not sticking directly through the jelly. You try to avoid sticking through the ultrasound jelly if you can. That's just another sterile kind of technique. So put your jelly up top, move your jelly kind of with the probe down to your site, and you won't have any jelly where you're sticking. And then you stick right underneath the ultrasound probe, and we'll see that in a second too. Any questions on how to prep the probe once you? We'll show a demonstration.
Once you show
too,
it
so,
all,
yeah.
I think we'll get it.
So this is how to hold the ultrasound probe itself. C technique. I don't have anything to hold, but if you grab it like this, C. If you grab it over this side, go non-dominant hand. Thumb on one side, all the other fingers on the other, and then you can rest your hand and the probe on the skin at the same time, and that'll help you kind of balance it. If you're trying to hold it on top like this, you get kind of wobbly, so the C technique there, you can rest your pinky or your whole hand on the skin as you move it up and down. That'll help you stabilize it. So the ultrasound machine also should be on the same side of the bed as you're inserting. So I have my machine here, my patient's here, and I'm still like this, same side. I'm not trying to look across the table, because if you need to adjust anything, you have to walk all the way around. You want it right there beside you when you do it. I know some doctors, they put it on the other side and they do it anyway, but it's best to have it on the same side you're on. And then you align your center arrow on the probe with the center dots on the ultrasound machine. So that center arrow and the dots on that screen we saw are in line with each other. And that's how you know you're centered on the screen and on the probe. So those are the dots again. That's where the arrow on the center of the probe is these dots. So with the technique, you first align the vein on the center of the screen with the dots in the center of the screen. Make sure you measure the depth of the vein prior to selecting it, and then it shouldn't be more than 1.5 centimeters again, which is that third line. And so I have the ultrasound probe up here with the arrow. That's going to go right in line with this. This is more likely the artery, so you want to get it in line with the vein here. But it could be a vein, just depends. So once you have it in line, then you can mark your site up here on the skin, and then you track it up. Do the same thing, 4 or 5 inches up the arm, so you know which direction you're flowing. This is that angle here, 45. That's 45 degrees. It can go even steeper, 65 degrees. So that's a little steep for people to start out with. They think you're gonna hurt somebody or whatever, but I've done probably over 1,000 of these, and the only part that really hurts the patient is when they're going directly through the skin. So when I start them, once I get ready to go, I poke it through the skin real quick, and then after that, I go real slow, and they don't even feel it once you get through the skin itself. That's where all your nerves are in the skin. So they say it's not as bad if you do it that way. Just get through the skin, go ahead and get through the skin. Then I'm looking at the screen the rest of the time, and I'm finding my needle tip and getting, tracking it down. We'll see that in a second too. But that's your angle. Once you reach the vein itself, so I've gone this steep angle down to the vein. I've got it in the vein, and then you drop the angle down and follow it a little bit further, and then thread it. So that's your 2 angles there. So like I say, once you get through the skin, you keep your eye on the screen, track the tip of the needle as it threads down into the vein. You must move the probe with the tip of the needle to visualize it directly underneath. So as you thread your needle in a little bit, you move your probe up a little bit. So it has to go together for you to keep your eye on the needle itself. And that's the most difficult part when you first start, is tracking that tip of the needle. And just once you get through the skin, you just move real slow as you want to go. Try not to keep looking back at the insertion site, because that's not really doing anything for you. Once you get through the skin, you're right over the vein. Then you just keep looking at your screen over here, and don't keep looking back at this. Once you look at this again, you have to look at the screen. You lost everything on the screen. You have to refine your tip and all that. Look at everything. So try not to keep looking at the insertion site once you're through the skin. That's an important point. And then we're looking for a bullseye in the middle of the vein. And that's how we know we're in the vein. And we'll see that image on the next slide. Once your bullseye is visualized in the vein, drop that insertion angle down and keep the bullseye while you follow it in the vein. You'll be able to move your needle around, and you'll see it moving around in the vein. You just want to keep it right in the center of that vein. And as you track it, you want to keep it in the center, and then you thread it. So after adequately tracking the vein, attempt to thread the catheter over the needle. If resistance is met, pull the catheter back onto the needle and keep trying to get your bullseye, and then thread it again. If you can't get it to thread, then you may be through the vein. Sometimes it'll be like this, but you'll see a bullseye, but your needle's all the way through the vein. That's because your probe is behind your needle tip. You gotta keep it on the tip of the needle. And we'll go over that in a second too. So this is the needle actually in the vein, and that's kind of what it exactly look like. It's not very defined. It's just real, murky looking, I'd say. So that's the bullseye. It does need to be more over here, but that's kind of initially when you get into the vein. So you'll want to, a steeper angle and get over into the middle of this vein, and then just keep tracking it. So that's what you're looking for. That's how you know you're in the vein, is when you see that dot in the middle there. That's the tip. That's the tip of the needle into the vein. So if you lose the catheter tip on the machine, and you keep inserting your catheter, you may puncture all the way through the vein. If this happens, you can retract the needle and the catheter until the needle's visualized in the vein, and then proceed with tracking it in the vein again. That's kind of hard to visualize without a video, but you'll see it kind of down here poking around. You've already got flash in your catheter. You'll see it down here poking around. Well, you want to keep pulling that needle back and tracking it with your probe until you get another bullseye, and then you can thread it again. You'll have enough catheter to thread past that where you poke through the vein, so you can always pull back, get your bullseye, and then thread it. Just like a normal IV, if you feel like you poke through it, you can kind of pull back and thread. So that just comes with experience, really, troubleshooting that. But so documentation.